of as like encampments or people sleeping in tents, people sleeping outside. We also know that homelessness can be less visible. So somebody who might not have a home of their own, they might be doubled up with someone. They might be couch hopping. They might be staying with friends and family for short periods of time. Or, maybe they'll say, hey, can I throw you $10 and I can stay here for a week? And so those folks are considered to be experiencing homelessness because they don't have a place of their own. They don't have a key of their own. They don't have the same protections as you might have if you're a homeowner or a renter. But that's much less visible, right? And we know that those people do make up a significant portion of the folks experiencing homelessness in our cities. We also know that there's a lot of power in personal stories, and we know that it can be so touching and motivating to hear personal stories. But we also know that we cannot tell other people's stories without their permission. You'll hear AJ and I probably refer to folks that we might know in the community and use general examples of people's experience, but we don't want to tell stories that are not our own without the express permission of those people first. And that's really, really important because sometimes if somebody might be experiencing homelessness, their story and their identity might be one of the only things that they feel like they have and they have control over. The other thing that I want to really mention that you'll hear me talking a lot about lived experience of homelessness. This is something that is absolutely central to our work at Align Minneapolis. We want to center the voices of people with lived experience of homelessness. We know that their experience of homelessness is what's going to help us understand how to move forward, how to be advocating, how to be coming up with solutions. It's not up to those of us who have not experienced homelessness to tell people what they need, right? So we want to lift up their stories. We want to learn from stories. We want to hear from folks, and we want to then think about like how does that inform the work that we do? All right. I do just want to touch a little bit about the impact of COVID-19 on homelessness. So we know that over the last couple of years, there had quite a bit of impact that has happened during the pandemic, both I would say positive and negative. We know that the pandemic has put additional pressure on our neighbors. There's been job loss, there's been loss of childcare, there's been enhanced medical needs. We also know that the pandemic has shown us that there's a lot of creative solutions out there that have actually helped and provided some additional resources that we didn't necessarily think of before, or we didn't necessarily have the motivation to do before. So things like funding that has come in during the pandemic that has provided shelters provided so that shelters can be open 24/7 rather than shelter and then they have to leave by 6 a.m. And then they can't come back. They have to find something to do all day until the evening. So most shelters now have the availability to be there 24/7. We've seen hotels be converted into housing when hotels weren't being used for tourism, because the pandemic shut all that down. People were able to stay in hotels because they were available, they were abundant, and that actually then even led into one of the solutions that I'm going to talk about later. We've seen added services. We've seen money coming in for services that wasn't there before. And we hope that some of this one-time money then will show people, hey, there's a lot that we can do if we just provide more funding and look at these examples that we've seen during the pandemic. We've also seen on the prevention end of homelessness, preventing homelessness, we've seen additional assistance come in. There's a state program called Rent Help MN that has provided quite a significant amount of money to help folks get caught up on their back due rent. And that has really helped people to remain in their home know that one of the best ways to end homelessness is to prevent it from occurring in the first place. And so that significant state program has, at this point, I think they've sent out the door millions of dollars. I don't know the exact statistics as where we're at today, but it's been millions of dollars. And we also know that on the flip side, shelters have faced significant additional pressures during the pandemic. We've seen that there's been increased needs in order to prevent outbreaks, but that there's been also like increased pressure on staff. There's staffing issues. It's hard. It's a hard job. And so we know that there's also been some really ways that our services and our systems have been stretched. So going into kind of this, what I call the spectrum of responses, I just want to touch on a variety of things that we know are out there, that are programs that exist, and that are things that are working in our community, that are already in place. So as I mentioned, prevention is a huge piece of ending homelessness. We want to prevent homelessness from happening in the first place. And the way we do that is by keeping people in their homes. I mentioned the state program, Rent Help MN. We also have some local programs at the county level, county emergency assistance. We have county contracted programs. They're called FHPAP funds. We also at Align have our own program called our Emergency Rental Assistance Program, where we help to provide direct rental assistance when somebody is facing a crisis, they've fallen back in their rent, and we help them to get caught back up. We also know that shelter is a necessary resource to address the needs of folks experiencing homelessness. And the key here is really providing safe and dignified shelter when it's needed. We hope that it's not needed very often. We hope that it's not needed for very long, but we know that it is something that is needed in our community. And there are times when our current shelter system is stretched to the point where they aren't able to meet the needs. We know that particularly when there's significant cold snaps, there are additional shelter beds open when it's significantly cold. Like I think the threshold is below zero. However, there's no guarantee that the shelters that exist can actually meet the needs in our community. We know that services are a huge piece of addressing homelessness. Focused case management is something that has been shown time and time again to really be part of the resolution. If someone is experiencing homelessness, they face so many different barriers to finding housing and getting out of homelessness, and having services such as case management and other types of services where they're being connected directly to resources, it's critical. And we know, and actually the county just stood up a new team of housing case managers. They're working hard. They've already housed a handful of people just in the last few months. And they are basically they're just out there helping folks get connected to resources, helping to find what housing is available, and doing a lot of the legwork that can be so hard for folks to do on their own. We also have seen in our city, particularly since the uprising, but even before then, there's a huge amount of mutual aid that's happening on the ground. These are community-based grassroots networks. Sometimes it's just person to person that are helping to connect folks either with other housing opportunities, connect folks with resources, connect folks with money and things that they need to physically be able to stay in their housing or access housing. And these things sometimes are hard to capture, but I think what has been so amazing that I've seen is that there's just so much passion and commitment that is just from volunteers, and it's just folks that are feeling moved to try to make some type of a difference, and they're just out there sometimes on the ground within encampments saying, hey, what do you folks need, and how can we support you? So really, really incredible work being done there. So one of the things that you'll always hear when we talk about homelessness and housing is that we need more housing. There's not enough housing. We know that there's a need for housing across all sorts of income levels, but particularly for people at income that is at or below 30% of area median income. So we call it 30% AMI. So this would be, for example, folks who maybe they're on disability, or maybe they live off of Social Security. They have limited incomes, lower incomes, and it's really, really hard to find places that are affordable for them. And so we know that I think the statistic is somewhere around 80% of renters in Minneapolis are what's called cost burdened, which means they're paying more than 30% of their income to rent. And if you think about, let's say, for example, somebody has $900 a month in their Social Security disability income, affordable rent for them is $300 a month. And so if you're at or below 30% AMI and you're talking about affordability, there's not many options out, right? And they are hard to access because, folks will stay in them for a while. And so we know that there's a need for more affordable housing, and specifically affordable for those at or below 30% AMI. We also have seen some really interesting non-traditional solutions that are popping up. I mentioned the hotels prior, being used for housing folks during the pandemic. There's actually initiatives happening right now that are the county is working to purchase hotels and convert them to housing, and they call it something. It's called something single room occupancy. So it essentially means that you don't necessarily have a full apartment. You may not have a kitchen. Some might have a kitchenette, and you might have a shared kitchen. Most will have their own bathroom, but there are times when there's, shared resources. But it can, because it's smaller and because it doesn't necessarily have the full amenities, it can be much, much more affordable. And so the goals of these hotels that are being converted to housing is to rent them somewhere in the $300 to $400 a month range. So again, meeting a need for a really, really affordable housing. And affordability. I'm just gonna keep talking about affordability. When we talk about advocacy, there's so many that we can talk about related to affordability. We can talk about rent stabilization, which is a conversation that's happening right now in the city of Minneapolis. We can talk about preserving the affordable housing that already exists and not allowing it to be sold to developers coming in from other cities and wanting to split up housing and convert it to luxury rentals. We can talk about universal housing vouchers. That's an initiative that is going to be put forth in our Homes for All legislative agenda to try to get, when we say vouchers, what we mean is like some people think of Section 8, that's a type of voucher. So essentially it guarantees that somebody doesn't have to pay above 30% of their income, and then that the remainder is covered by this voucher. It's essentially a subsidy. We know that we need more home ownership opportunities. We need expansion of opportunities to help with home ownership, and then things like opportunity to purchase. So this is like if a landlord is to sell a property, they give the current tenant, the first right of refusal to allow for them to stay in the place by purchasing it, and what programs might be available to help them to do that. And then of course, when we talk about when we talk about housing, when we talk about rent, when we talk about affordability, we're going to also come back to the livable wage. And, we know folks have a livable wage because a lot of folks we know are working, and when they're working 40 hours a week and they're still not able to afford rent, that's a problem, right? And so we talk about a livable wage. What does that look like in our city? And how can we make sure that when folks are working, they're able to afford, dignified place to live of their own? All right, so I'm just going to touch a little bit on Minneapolis specifically as an organization. So some of this information was mentioned a little earlier. Um, we are an interfaith network. We have 17 member congregations. This includes Christian congregations, Unitarian, Jewish, and Muslim congregations, and mainly within kind of the core of Minneapolis, but also kind of across Minneapolis. Originally, our organization was called Downtown Congregations and Homelessness. It is now aligned because we've expanded back beyond downtown. So we have congregations represented across the city. We do a kind of, I would say, two main prongs of our work are direct service. So our member congregations that provide direct service, such as the meals that are provided at Plymouth each Sunday, and the outreach work that's done over at the Basilica, connecting folks to resources there. So there's meeting immediate needs, right? Direct service. And then we also have congregational organizing that we do that is really trying to get at some of the root issues of homelessness and some of the root solutions to homelessness. And so organizing around issues and doing a lot of advocacy work at the state level, at the city level, and at the county level. Align also supports a group called Street Voices of Change. Some of you may know of Street Voices of Change and may have been able to meet some of the folks there or heard from them presenting in different forums. This is a group of people with lived experience of homelessness that they get together twice a week, and they work on issues that are near and dear to their heart, and then advocate and organize around those issues. So one specific example of an issue that they organized around is what they call the Shelter Residents of Rights. They were a lot of folks that had been experiencing stays in shelter within Minneapolis were having excuse me, a lot of folks were staying in shelters, facing a variety of issues, and we're seeing that the conditions in shelter were not what they would consider to be safe and dignified. And so the group created what they call the Shelter Residents Bill of Rights and organized and worked with the Hennepin County system and Hennepin County commissioners to actually get it implemented within the Hennepin County system. And then that has actually now gone to the state level. There's a statewide task force on shelter that is now tasked with what does safe, dignified shelter standards look like across the state and what's the appropriate oversight for that. So really, really powerful work, really impactful for folks who are experiencing homelessness. Another big part of what we do at Align is our emergency rental assistance program. I mentioned this earlier, kind of on the prevention end of preventing homelessness. And I just want to share a few statistics from our 2021 year that we just wrapped up. We served 64 households. That includes 25 households that were families with minor children and 39 households that were adult only or single adults. We provided a total amount of assistance of almost $150,000, and the average amount per household was just over $2,000. And so you can see that, even just a few $1,000s really made the difference between somebody potentially losing their home after facing some type of crisis. But even just that, what I would say for some of us might be a, kind of a small amount. It doesn't seem like that much money, but it really makes a world of difference for folks who are trying to stay in their home. So that's just a little bit about Align. So I do want to open it up now to Q&A. And I am going to stop sharing my screen. Whoops. I will try to turn on my video. And if it stops working again, then I will turn off my video. But I'd like for to be able to see. So have any questions popped up in the Q&A, or does anybody want to raise their hand and ask some questions? Otherwise, EJ and I might just kind of have some questions prepared to chat about.
Let me start with one, Katie, and then hopefully we'll hear from some of our audience. We're talking about some of the barriers people who are experiencing homelessness face, and I wanted to get specific about some of those, or maybe we could talk about some of those, and particularly the systemic barriers that they face to getting housed again. So What are your thoughts on that?
Yeah, so I mean, there's so many different barriers, but just to kind of name a few. So we know that that affordability is a barrier, right? I've talked a lot about that, and particularly for folks who are on limited or low incomes. So one example I like to share is if somebody is on government assistance that's called MFIP, so that's assistance for families, their income might only be $500, maybe $600 a month. And again, if you do the math, what would be affordable for a $600 a month income is $200. So does anybody know of a place that someone could rent, with maybe a child or two for $200 a month? That's, it's simple math. And unfortunately, there's just a lot of limitations like that. So that's one barrier that we know of. We also know that things that are on people's background can be a real barrier. So this might be something like criminal history. I don't know about all of y'all, but I sometimes didn't make the best choices when I was 18 years old. Luckily, I have enough, privilege that I didn't necessarily get into the same level of trouble as other people might have at 18 years old. Fast forward 20 years, you might have something on your background that's going to prevent you from renting a place, even though, maybe you're not getting into the same level of trouble, and, you've learned a lot, and maybe aren't doing the same things you did in your youth. So that's and then also in terms of background, we know that sometimes eviction history can be a real barrier. So landlords are hesitant to rent if you've had a previous eviction, and those things can stay on your record for a while until you take the time to I think it's after like 10 years you can work to get it expunged. And so
that's a double whammy, because often when you're evicted, that puts you in a situation where you're facing homelessness, sleeping in your car, sleeping on a friend's couch, and it makes it very difficult to get rehoused again because landlords do look at that history, or at least traditionally have. Yeah.
Yeah. Yeah. Other barriers that we see, sometimes sometimes, well, and this is where sometimes the housing case managers can come in really and be really helpful, is if, like, let's say you have experienced marginalization and you have experienced shelter, and it's really impacting your mental health, and it's really, you're kind of in a really down spot. Things like calling around and seeing if places are taking applications, and then going through an application, and potentially paying an application fee and going to look at places, all those things. I mean, it can be a really, really heavy lift for someone who's just trying to make it through the day. And so, I sometimes find like tasks like that really tough. And I'm not in a position where I'm having to just survive each day. And so even things that are just like going through those steps can be a real barrier. I mean, if you don't have a phone, how are you going to call around, to see if places are available to rent? So,
And
so
we're all
sometimes
here on
it's,
our computers this morning and searching Craigslist or other places where each of us might go if we were looking for a new place to live. It is really hard
yeah,
without that, and without that ability and that sense of how to navigate through the system, through the computer system, even, which we take for granted.
exactly. Exactly.
Other things I've seen is a lot of landlords require security deposits. I think those of us who are renting now or who have rented in the past, probably all of us have had to put down a security deposit, and often first month's rent before you start. And who has the savings, particularly if you are experiencing homelessness? It's kind of logical that you don't have $1,000, $1,500 in the bank to put down as a security deposit and first month's rent. Or if you were evicted, your landlord might be holding on to your old security deposit, so you don't have the security deposit to turn around like some of us do when we move from one apartment to another one. So that's
Yeah.
another challenge.
By the way,
Absolutely.
I'm seeing some questions. I don't know if you can see them as well. I'm happy to read them unless you'd prefer EJ or Katie to read them
Yeah.
yourselves. It's up to you.
Sure. I can start reading through them, and maybe EJ, you and I can kind of tag team to answer. So, first question: could Plymouth build affordable housing on the parking lot north of our building, or work with Beacon to build it? And how many units of affordable housing is Minneapolis short? So I would say, why not, right? Like, that is a conversation that Plymouth should have. Is that an option for us? Is that something that we want to do that helps us live into our values, is using our physical space to be able to provide housing? I've seen a couple of churches in our local area doing things similar. So Calvary Church at 39th in Chicago has just sold their building to a developer to do affordable housing. St. Olaf downtown has sold what they call the airspace above their parking lot to put up housing. And so that's definitely something that's happening out there. When we have physical assets, how can we use them to really be part of the answer? And then in terms of how many units we need, I don't actually know the answer to that. The how many units of affordable housing is Minneapolis short? I know it's not insignificant, and the need is going to continue to grow, but I don't know the actual number of units. I don't know, EJ, do you have any insight into number of units of affordable housing that we need?
I don't. I do know Plymouth is located in the Stevens Square neighborhood, technically. And looking at data that the Wilder Foundation compiles along with Minneapolis Foundation, McKnight, and all, as of 2019, so pre-pandemic, 57% of the renters in the Plymouth neighborhood were cost burdened. So in other words, 57% of our neighbors who are renting pay more than 30% of their income in rent. So there's kind of the tip of the iceberg. There's the people that Katie talked about that we see in encampments who are in shelters. And then there's a lot of other people who really are paying what the market requires them to pay, and they're paying too much. And so those people are one step away from potentially being without unhoused as well.
Right. Yeah.
And then there's,
All right, sorry, go ahead,
go
Maya.
ahead, go ahead. No,
Oh, I
there-
was gonna say, okay, how are you different from Beacon Interfaith Housing? Do you work together? So there are a lot of similarities between Beacon and ourselves. Beacon is much larger, I would say, but they were also born out of a faith community. They are also, working within faith communities to do organizing. And so there are a lot of similarities between us. The one way that we work together is we do sit on some coalitions together. So for example, the Homes for All Legislative Coalition at the state level, which is working on homelessness across Minnesota. So that's one way that we interact, and we sometimes, kind of come together on certain issues. I would say that there are some issues that we would absolutely be in lockstep on, but as a line, most of our issues that we're going to be organizing around are really going to be driven by our Street Voices of Change group, identifying what is most important to the folks that are actually experiencing homelessness. And so that may look a little bit different, whereas Beacon oftentimes is focused on building and housing affordability.
I see a question from Jackie Prince that kind of is an area I'm passionate about. Jackie asked, were direct payments to individuals during the pandemic as successful as seemed to be the case? And did this eliminate some of the bureaucratic red tape? And the answer to both is a yes, absolutely. In spending time with clients and volunteers around the food shelf, those direct payments were just essential to people being able to balance their budget, live, and in many cases, stay housed. And I heard personal stories about that. And the wonderful thing is, it more or less just showed up in many people's bank accounts if they had filed a tax return or have Social Security disability, which a number of the clients of the food shelf do. So it was just terrific. And it's led to, actually before that, a number of cities around the country are experimenting with direct income payments to see if that might be a more efficient, more dignified way of working with people who are really experiencing poverty. So the city of Stockton was one of the first in the United States to do it, and just had a huge amount of success, and perhaps showed that the stereotypes many people have that if you just give poor people money, they're going to use it on the wrong things it proved to be absolutely not the case in Stockton. In both Minneapolis and St. Paul, there are small pilot studies to do exactly the same thing that are being run in conjunction with the Minneapolis Federal Reserve. So in essence, you can have a real-time control group, people that don't get the funds, which is what they did in Stockton as well, and those that do. And so we're going to have real good data around doing this direct intervention with people. So I'm interested in following that.
Yeah. Thanks, AJ. That actually touches on a little piece of the next question around programs giving cash payment directly to folks every month, no strings attached. And what we're seeing, and I mean, it's sort of a math answer that can actually seem pretty simple. It's, when people have enough money to meet their needs, there's a lot of benefits, right? Housing stability, kids being able to have their needs met, and so there's just a lot of upside. And so I hope that the pilot programs in Minneapolis and St. Paul, I hope that those really show us that this is a great kind of portion of the answer, right? Part of the other part of Tom's question, some time ago, there was a state of Minnesota project to end homelessness for veterans. I think it was pretty successful. Are there lessons to be learned from this experience? To be honest, I don't know a ton of detail about the state of Minnesota project to end homelessness for veterans. I do know that there's been a lot of focus on the veteran community, and that there's been areas of Minnesota which have which have considered themselves to have eliminated veteran homelessness. One of the things I do know about with veterans is that there are housing opportunities and housing vouchers that have been available specifically for this population. And I think it again goes to show that when you have specific resources that are focused on certain groups of people, you're going to be able to help those folks. It's just there's not enough resources then for, kind of at the broader level. So we need more of those programs, I would say. I mean, it's more of the direct payments, it's more of the housing vouchers to make things affordable, it's more of affordable housing, it's all of these things that sort of like it hits on all the different pieces, and there's no one big solution, but it kind of like takes away at it. So
And that touches on, because of course we need all those resources, but we need the human resources to help reach, in that case, the vets, and maybe have former vets go out and talk to them. So just like in our healthcare system, sometimes the limiter is not just the lack of beds, but it's the staff that can respond to this increased demand. And even as we keep our shelters open 24 hours a day, 7 days a week, which is a terrific improvement, you need more people to be there to do that. And these navigators, Dawn asks about resource navigators, but it's just a shortage of people. So we bricks and mortar is important, vouchers are important, but then we also need people that help others navigate the system. Katie talked before about some of the barriers, and you need someone that can help work through applications, which can be long and difficult, the computer searches, drive you out to, if you don't have any transportation and you live in downtown Minneapolis and your the project is in Bloomington, maybe drive you there, because it's tough to get to Bloomington to talk to someone in the morning and then Brooklyn Park in the afternoon. It's just, so you need those little things make a difference.
Yeah, for sure. Next question, Elizabeth Glidden referred to the criminalization of poverty. Is the city council or maybe some other entity doing anything to address this? So I'd say this is a really powerful and important question, and one that I think we need to really have a reckoning with in our city. We were actually just talking about this recently at the Street Voices of Change group, because I think generally, I don't want to say it's every single person all the time, but generally there is a sense that particularly folks experiencing homelessness are over criminalized, are over policed, can be brutalized, can be abused by the system. And it can look different for different people, but I think the overall sense is that there's such a lack of protection and a lack of feeling of being valued as a human and human dignity when folks are out there, so for example, criminalization of poverty, if you don't have a place to sleep and you're sleeping on a bench, and then law enforcement officer comes and, tells you to leave, and maybe you don't really have anywhere else to go. And so maybe you get a ticket or arrested for, whatever it may be. Whereas if you had your own home to go to and could go, into your home to lay down to sleep, no one's going to bother you. And so I think that, I don't know, I don't know that I have the answer, but I know that it's a concern that's out there. And I do think that the city council needs to be working on it. I think the mayor needs to be working on it. I think the law enforcement needs to be working on it. I think that there's some movement happening in terms of trying to shift somewhat more into like public safety responses that might include people like social workers or folks that can connect people to resources rather than just a pure law enforcement response. I think that's moving in the right direction. We know that there's a lot of work to be done in this area, and some of it needs to happen at a leadership level, and some of it needs to happen at a training level. And so, there's just at every level, really, for sure. So I don't know that there's anything as clear as I would like to be addressing this. But one thing I'll say, our own Reverend Davis, Dwayne, he's on the new commission that the mayor put together around public safety. And so, maybe it's a conversation with him and making sure that he and that group are really understanding that there's a pretty negative impact for folks who are on the ground, and that's something that they need to be working into their whatever solution.
Let me add two things, and then I see that Dawn and John's questions coming up really relate to some of the same things, so maybe we could address that. Much of the funding for housing solutions, so Katie mentioned these hotels or motels,
like resource navigators.
Yeah, so much of the funding for this comes from Hennepin County. So Minneapolis and so that the motels that are being purchased are by Hennepin County. So the funds addressing this, a lot of it comes from Hennepin County. One small but important thing that the city council did about a year and a half ago, and we haven't seen how well it works yet, is they enacted a new tenant screening ordinance that was intended to protect applicants from being excluded, at least to some degree, because of their criminal background history, their credit scores, if they have an eviction in their record, and even keep them from being abused by being charged too much security deposit because of who they are. Katie, why don't you go ahead on the Dawn and John's question?
Sure. Yeah. So connecting to resources, navigating things like that. I would say hard to know how that will look right now, but I think that's something that, as hopefully we get into maybe more of like a waning of pandemic time. Oh, hold on. When we get into a waning of pandemic time, I think that's something that we should have conversations about how that could look, because I think, yeah, it could look like a group of volunteers getting together to do that. Maybe there's like a set time and place when we could do that together, that folks, know they start to know how to access that. So I think that's something that we should, as Plymouth, continue to have a conversation about. I don't think there's anything in place right now, but
let me tell you about one informal experience that we could build on, and Dawn was behind this. And Gene Kennedy from Plymouth helped as well. They basically helped act as informal navigators with the Rent Help Minnesota applications. So those applications to help pay for back rent. And they set up a table outside the exit for Groveland Food Shelf this fall, and helped make people familiar with that, handed them applications if they needed it, let them know where to go online. And they talked to at least a couple hundred people. And on top of that, they helped people fill out and come up with the documentation. The application was either 11 or 16 pages long. So both Gene and Dawn help people complete those applications. Some people have language difficulties or just have difficulty reading, don't have access on computer. And it wasn't clear exactly what documents needed to be submitted in support of that. So that was really well received, and they really changed people's lives. And I know in a couple instances, kept people from being evicted. Both Dawn and Gene talked to some of the building managers on behalf of some of the tenants and said, this person is filing this application for rent help, and that means you may not evict them under state law right now. So I think that was a really successful experience, and we at Plymouth could build on that.
Yeah.
Love that. And I think one of the other things that was great about that was it was meeting people where they were at, it was folks who maybe had been accessing the food shelf and kind of already had a relationship with folks, and really just saying like, all right, we're here, what do you need? So that's a great example. Just really quick, I'm going to share my screen one more time for some additional resources that folks can use to find out more information. I'm just going to pull it up here. So I have here, we have, as Align Minneapolis, we have something called a campaign guide. So we have 3 that we launch each, 3 seasonal campaign guides. Right now we're in our winter one. And these guides have all sorts of resources around education opportunities, volunteer opportunities, advocacy opportunities. So definitely take a look at that. I can also pop this in the chat. I also have a link to the Wilder research study that does provide some great statistics about what homelessness looks like in our city. They usually do a report on a 3-year cycle, but they weren't able in 2021 due to the pandemic. There is a rent stabilization study that Cura released in the fall. So this is really great information that can inform what we do as a city around rent stabilization. And then we have some self-guided education resources as well on our website. And then I do just want to also share, if anybody wants like screenshot these, or you can get in touch with me or EJ if you want further information about things like our emergency rental assistance program, about how to connect folks to shelter resources, things like that.